is taking a closer look, including just how much it'll cost you.
Just to give people an idea of the cost savings that we're talking about, according to the Kaiser Family Foundation, for a family of 4, every year you're paying about $21,342. That's a family of 4. You're paying more than $21,000 a year for insurance. Now, if you guys are still charging $75 a month, is that what you're still charging?
Yes, we are $75 a month. Yes.
So $75 a month plus the fees for added family members. A family of 4 with you guys pays about $2,160. I mean, we're talking about almost $20,000 in savings to go to direct primary. Now, of course, again, that's not counting the specialist and the prescription costs, but that's not counting it with insurance either. You know, I mean, that's a big cost savings.
Yeah, I mean, even if the $21,000 does not count the deductibles, right? So you're paying first dollar out of pocket, and most of the times, you have HSA, health savings account, which means you are at a higher deductible. So you're paying until you meet the deductible out of pocket, and then the actual insurance kicks in. Sometimes there's co-insurance, so you're paying part of it, and the insurance is paying part of it. But it takes the out of pocket maximum, when the actual insurance hits. And so you don't really need those, especially for primary care. Primary care is a lower cost healthcare. Like they say, use the lower cost first because it's the most effective. Don't wait until you go to the more expensive part of healthcare where you really need insurance to access those parts of healthcare. So this is kind of planning yourself to have all of these things done up front, taking care of yourself proactively, and we make all of those possible. Direct primary care helps patients do those things, for a very less cost.
And the reason I wanted to talk to you, I know you're located out in Tomball, Meridian Springs. I love you guys, but you've also helped other locations open up across Houston. So people can look up direct primary care offices closer to them if they're not located in Tomball. And I just want to give people a better idea of what kind of access does this give them to their doctors. I mean, I know Dr. Rao, she answers text messages from patients. She'll answer it at nighttime, on the weekends. Tell us the bonus to being part of a direct primary care instead of a regular physician's office.
So with direct primary care membership, you get unrestricted access to the doctor, which means that you can visit the doctor as many times as possible. There's no visit fees, there's no co-pays, deductibles, because we are not insurance. And then you have text access to the doctor, so you can directly send text, and this is across all the direct primary care clinics across the country. This is common, is you can text your doctor. Sometimes if there's emergencies that happen during the weekends, we do see our members send texts and the text is not just the text message. It can be with pictures, or it can be with videos. My child got hurt. This is the picture. Do you think I need to go to an urgent care? Can I wait? So these are the typical questions that we get. And then based on that, we can tell them what needs to be done. And which is the whole idea of healthcare it was built on the foundation of primary care, where the doctor needs to be guiding you in the healthcare system. Because by ourselves, if we go Google, we are not experts, right? You need an expert that can guide you in the healthcare system, help you navigate. That's your PCP. Your primary care physician is the one that plays the role of telling you, oh, you need to go get higher level of care. You need a specialist. You need to go to an urgent care. So all of these guidance you get with your PCP in this model. You don't get it in a traditional, primary care setting.
And that was health reporter